Health and safety culture. Explain a need for additional health and safety training. Job change. Promotion, especially into a management position. Restructuring, reorganization. Change of process or equipment. New legislation. As a result of risk assessment. Inspection or audit. An unacceptable number of accidents, incidents or ill health. Enforcement action. New buildings, acquisitions. Explain the factors to be considered when preparing and presenting a training. Identify the training needs. Identify training objectives. The target audience, existing knowledge, skills, relevance of training, motivation, capacity for learning, essential prior knowledge. Identify training methods, lecture, video, group work, role play, toolbox talks, on-the-job training, etc. How the effectiveness of the training will be evaluated, for example test, examination, quiz, work monitoring, practical demonstration, test piece, long-term monitoring of accident statistics, etc. Number of trainees. Time available. Training aids required. Suitability of training facilities, location, room size, layout, lighting, car parking. Refreshment breaks during the course, start and finish times. Course rules, mobile phones, interruptions, emergency procedures. Course administration, register, evaluation forms, travel arrangements, course material, etc. Explain the entitlements of representatives of employee safety under the regulations. Being provided with reasonable facilities and assistance. Being given time off with pay for training and enable them to carry out their functions. To make representation to the employer on hazards and general matters of health and safety. To be provided with the information necessary to enable them to carry out their functions such as that contained in records kept under the requirements of RIDOR. To be given the facility to represent employees in consultation with inspectors. Explain the health and safety matters on which employers must consult their employees. The introduction of any measures at the workplace that may substantially affect the employee's health and safety. The arrangements for appointing and or nomination competent persons. The H&S implications of introducing new technology. The planning and organization of H&S training. The information that the employer is required to provide under other regulations, such as that relating to risk assessments, preventative measures and emergency procedures. Hence employers are not only obliged to provide information but must consult their employees on the appropriateness of the information before it is given. Give reasons why a health and safety committee may be ineffective. A lack of management commitment. No agenda or remit and or no minutes or notes of the meetings being produced. An uneven balance between management and employee representatives. Poor chairmanship. No access to the decision-making processes. Infrequent meetings. Inappropriate topics. No access to health and safety expertise. Describe the 4 classes of safety sign. Prohibition. The signs are round or circular with the main color being red, at least 35% of the area of the sign. They have a black symbol or pictogram on a white background with a red border and diagonal crossbar. Warning. The signs are triangular with the main color as yellow, at least 50% of the area of the sign. They have a black symbol or pictogram on a yellow background with a black border. Mandatory. They are circular with a solid blue background with a white pictogram. Emergency escape or first aid. The signs are rectangular or square with the dominant color being green, at least 50% of the area of the sign. They have a white symbol or pictogram on a green background. And firefighting. The signs are rectangular or square with the main color being red, at least 50% of the area of the sign. They have a white symbol or pictogram on a red background. Explain the functions of a trade union-appointed safety representative. Investigating hazards and dangerous occurrences and examining the causes of accidents. Investigating complaints from employees. Carrying out safety inspections. Making representations to the employer. Attending safety committee meetings. Representing employees in consultations with the enforcing authority. Receiving information from its inspectors. In order to carry out these functions, the safety representative has certain rights, such as access to relevant documents, the use of appropriate facilities, entitlement to inspect the workplace at set intervals, time off for training. Describe the organizational factors that could limit the effectiveness of the campaign. Lack of senior management commitment. Production or other pressures taking priority over health and safety. Insufficient resources allocated to the campaign. A poor safety culture in general. It should also have been recognized that poor working conditions are likely to induce cynicism towards the campaign amongst employees. In addition, poor industrial relations or a lack of confidence in management's ability could mean that the campaign is not given support of influential members of staff. Work patterns, for example shift work, could also mean that some sections of the workforce are not fully considered or supported, possibly due to the non-availability of key staff. Identify types of health and safety information that might usefully be displayed on notice board. The health and safety policy of the organization. The information for employees poster. Information regarding health and safety representatives, for example their names and contact details. Targets for the reduction of accidents and ill health and information showing the current level of performance against the targets. Forthcoming health and safety events including information on training courses available. Identification of first aid arrangements and procedures for evacuation in the event of a fire. Health and safety posters specific to current campaigns being run by the employers or HSE. A copy of the employer's liability insurance certificate. Explain the sources of published information. HSE ACOPS. HSE guidance documents and leaflets. Standards, international, European and British. Safety periodicals. Various technical and legal publications. Materials produced by employer and employee organizations. Materials published electronically, for instance on compact disc or on the Internet. Methods that an employer can use to provide health and safety information. Notice boards. Team briefings. Training sessions including induction and toolbox talks. Newsletters and the inclusion of messages with wage, pay slips. Posters. Competitions and signs. One-to-one briefing such as appraisal sessions. Explain reasons why an employee might require additional health and safety training. The introduction of new processes, equipment and methods of work. As a result of a job change involving different health and safety requirements and or the allocation of additional responsibilities. Following the introduction of new legislation. Where risk assessments or staff appraisals indicate that additional training is necessary. Where a fresher training is required such as that required for lift truck operators and first aid personnel. Following an accident, enforcement action or insurance impositions. To counteract the possibility of employees becoming complacent and lax in following established procedures for health and safety. Explain the main health and safety induction training program. The organization's H&S policy. Emergency procedures. Hazards specific to the workplace and the need to comply with health and safety requirements. Health and safety responsibilities and lines of communication. Accident and first aid arrangements. Welfare provision. Explain the issues that should be covered in an induction program. The particular risks in the working area, for example movement of FLTs, falling materials, conveyors and the possible presence of asbestos. General site safety rules regarding smoking, clothing and PPE, use of electrical equipment and so on. Requirements for PTWs and other controls. Exclusion zones and traffic routes. Arrangements for the storage of materials. Accident reporting and other emergency procedures, for example actions required in the case of fire. The location and use of welfare facilities including first aid. Describe when developing an extensive program. The completion of a training needs analysis is an important first step in the development of any program of training, that is comparing what employees need to know with what they already know. In deciding what employees need to know, consideration should be given to their responsibilities, the activities carried out, the risks associated with those activities, the actions required of employees to minimize such risks. It should have been recognized in this context that a senior manager, for instance, will have different training needs with respect to health and safety from those of a supervisor or a shop floor employee. An assessment would then need to be made of employees' existing knowledge, taking into account their previous experience, the levels and types of training already received, any indications of where deficiencies may lie, for example from incident data or by observation. From the training needs analysis would emerge information on the number of employees involved, the types of training needed and the resources, in terms of financial costs, time and facilities, required to carry out the program. The factors to be considered at this stage would include the competence and expertise of in-house staff to provide the required training, the possible need to involve external sources, the means of communicating the program to employees at all levels in order to seek their commitment to their views on the program, why it is important for an employer to keep a record of the training, to provide proof of an employee's expected level of competence, to identify when additional or refresher training might be needed, to enable a review of the effectiveness of the training to be carried out, to access the progress of the training program against targets, to provide evidence to be used in any future accident investigation or legal actions, explain the meaning of the term competence, need to possess knowledge based on appropriate qualifications and training, have skills and experience to apply the knowledge in a given situation, possess personal qualities such as appropriate attitude and the ability to communicate, and importantly a clear recognition of his own limitations. Why employees may fail to comply with safety procedures at work. Inadequate resources, whether of tools, equipment or employees. Unrealistic or ill-considered procedures. Lack of adequate information and training and a perceived lack of consultation. A poor safety culture within the organization. Fatigue, illness and stress. Lack of concentration because of boredom and repetitive work tasks. Poor working conditions. Mental and or physical capabilities not taken into account. Inadequate supervision. Peer group pressure. A failure to recognize risks. Ultimately a willful disregard of the safety procedures. Which employees' perception of hazards in the workplace might be improved. Increasing awareness of hazards, for example safety campaigns or posters. Involving people in the risk assessment process. Increasing knowledge, for example training. Identifying, including by the use of surveys, the reasons for employees' misperceptions in order to show how improvements might be achieved and how currently held view might be challenged, and addressing environmental factors, for example lighting and noise that might cause distraction or otherwise hinder the perceptual process. Explain ways of reducing the likelihood of human error. The use of skilled, trained and competent staff, including pre-employment screening issues. Motivation of the workforce. Task variety to prevent monotony and the provision of frequent breaks to avoid work overload. Addressing workplace environmental issues such as noise, light and heat. Mechanization and automation. Ensuring that controls on machinery are clearly marked. Implementation of a drug and alcohol policy. Providing competent supervision of employees. Why the seriousness of hazard may be underestimated by someone exposed to it. Overfamiliarity and complacency. Lack of instruction, information and training. Lack of experience, particularly where young persons are involved. The fact that some hazards, for example airborne contaminants or radiation, may be invisible and or intangible. Sensory impairment. Involvement in routine, repetitive tasks that can lead to lack of attention. Explain ways in which manager can motivate employees to work safely. Improving, by training and the provision of information, employees' knowledge of the consequences of not working safely. Showing the commitment of the organization to safety by providing resources and a safe working environment. Involving employees in health and safety decisions by consultation and team meetings. Recognizing and rewarding achievement. Why employees may fail to comply with safety procedures at work. Lack of management commitment. Overfamiliarization with the tasks to be performed. Repetitive work, leading to boredom and lack of concentration. Peer group pressure. Willful disregard of laid-down procedures coupled with inadequate or ineffective supervision. Fatigue and stress, lack of communication, training and consultation. Explain ways of reducing the likelihood of human error in the workplace. The use of skilled, competent and properly trained employees and ensuring that they are well motivated. Avoiding monotonous work processes and arranging breaks to counter fatigue. Designing clear roles and lines of communication with the workforce and ensuring adequate levels of supervision. Establishing good lines of communication with the workforce and ensuring the clarity of instructions and information passed on to them. Implementing policies on alcohol and drugs, prescribed and otherwise. Addressing the workplace environmental issues such as noise, light and heat. Designing the workplace and work equipment to reduce the opportunity for error, for example automation, unambiguous controls, information, monitoring and confirmation of actions and feedback loops. The possibility of human error, and its effects on health and safety, should also form part of any risk assessment, which should take into account previous incidents and the results of accident investigation. Explain the factors that might cause the safety culture. Lack of effective communication. The perception of a growing blame culture. Lack of leadership and commitment at senior level. Lack of monitoring or a failure to implement remedial action. Lack of consultation and employee involvement. A generally poor working environment. A high staff turnover leading to lack of continuity and loss of momentum in making safety improvements. External influences such as downturn in the economy, leading to job insecurity with the possibility of health and safety being seen as a less of a priority.
Please give comment and suggestions.
Thank you.
Subscribe our YouTube channel and hit the bell icon for more updates. Thank for visit our channel. See you next class.
Thank you.